Hey, I'm Matt Hadfield. I'm one of the fellows as part of the Fellows Forum with Oncology Data Advisors. I'm here with Dr. Thakur today, and we're going to be talking about how we learn in fellowship, which is a vast topic. Staying on top of information in fellowship is incredibly challenging. So to introduce myself, I'm Matt Hadfield. I'm a third-year Oncology Fellow at Brown University in Providence, Rhode Island. Interested in immunotherapy toxicities, as well as early drug development and phase 1 clinical trials. And Dr. Thakur, I'll let you introduce yourself.
Okay. So hi, I'm Richa Thakur. I'm a second-year Hemonc Fellow at Northwell in Long Island. And before I started Hemonc, I also did a palliative care fellowship prior. So for me, my research interests are really in quality of life, especially with patients in malignant hematology. I'm really excited to do this podcast with you guys too, because like learning in fellowship was so overwhelming, and it often felt like you just didn't really know what you were doing. And so hopefully we can provide some insight and give you guys some comfort to know like you're not alone.
Awesome. So I guess to get started, one of the things I find most interesting about training in general and oncology is just the vast amount of information that you have to sift through every day, both in clinical decision making and just big picture management for patients. And I was really curious what types of avenues you use to stay on top of information, different ways you learn both standard of care things and to stay on top of new data that's coming out.
I feel like that's been a huge challenge for me, especially starting with oncology, because there weren't a lot of resources that were geared towards like beginning in fellowship. And fortunately, my year, I think two really good podcasts had come out. Have you heard of like the Fellow on Call? And then obviously the other one was Onc Data Advisor.
Yeah. How have you incorporated those into your learning?
So I guess for me, when I first started, I just didn't really know where to even start, because like one thing with hemonc is you don't never really learn any of it in residency, like basic anemia stuff, but it's like chemo is chemo. I have no one
Right.
goes over that. Else. So usually, what I would do is I'd try to go through the podcast, and then there were like a few different series I used. So like the Fellow on Call was also really good, and then two Onc Docs, and so I would match the podcast to do groups at a time. So like if I wanted to do breast cancer, I would go through everything with one on like one of the podcasts, and then I would go back and use the second one to create my own outlines. And then I would also try to pair it with some of the patients I was seeing on consults, because for me, seeing the patient in front of you and how you treat the patient makes the information stick more. In terms of keeping up on like all of the newest trials, I feel like that's something I've really, really also struggled with. So I think most of what I've been really doing is trying to focus on a couple of different cancer types, and then I learn best from podcasts because I can at least listen to them while I'm driving to and from work. So like looking for a couple of podcasts in those areas and trying to focus on that's been really helpful. What about you? What have you been using to keep up, like both to keep up and to like get basic knowledge too?
Yeah, I honestly, to echo what you were talking about, I find it to be the same thing. When I started fellowship, I think, when you leave residency training, you have a scaffolding for how to manage things like CHF or COPD, but, something like metastatic melanoma, you don't know how to manage that. That's completely foreign. So for me, I think the big things podcasts too have been huge. I think I listen to the same ones that you mentioned, the Fellow on Call and Onc Data Advisors. Both I think help for me in terms of managing patients. There's so much gray area, and there's so many new trials that are coming out with new data so frequently that it really helps to hear from experts in the field. I think when you can hear opinion leaders in certain areas talk about how they manage patients, it at least gives you something to go off to make your own clinical decisions. I think those are kind of the things that I've been trying to glean the most from. I find that in oncology specifically, it's become harder and harder to just rely on things that maybe I did in residency, like MixApp or those types of those like home based things that you'd use to learn. Like board prep materials haven't been quite as relevant to me in learning oncology, just because I think the field changes so fast that you just can't rely on those types of sources of information like you could in residency for different types of diseases. But it's definitely a field that changes quickly, and it's hard to stay on top of. I guess piggybacking off that, you know, with the idea that things change quickly and there's always, vast amounts of um, new data, new things to stay on top of. What has been your strategy or methods for piggybacking off like your clinical time and trying to like work things in throughout the day? Do you find that there's different, sources that you go to frequently to learn, you know, about new developments in fields, or is there any specific ways that you learn to stay on top of things?
So I guess it really depends because like I just started my second year, so I still feel like there's areas where I'm developing like still very basic fundamental knowledge, which is where I use more of things like question banks or podcasts, and then like just like general review articles to get that. But like in other cancer areas where at least I've had much more experience, usually I would start with like one or two articles that like I would either get in my news inbox, like in an email, or like those articles you get in the mail, like with blood or with ASCO.
Mhm.
And then I would always read all of the like how I treat and then the review articles and then look at what was cited in the back of those and then go to those like publications for the areas that I felt were most interesting because I think as a fellow, there's like two areas. You're always building up your general knowledge, but to also keep up with like the most cutting edge, you really have to have like a really good fundamental of knowledge. And it's really tough to manage that in so many different cancer types. And so usually for me, it's I'll start with a review article and then finding the ones that are cited are like the easier way to go. So at least I have like fundamentals to understand the next level. And then I would look at more citations for what article seemed interesting in the next level.
No, that's a fantastic point. I think oncology's, I don't know if you agree, but I think oncology has much more data to stay on top of, and also much more controversial data. So not every trial that gets published is necessarily going to be changing your management practice or become standard of care. And you really have to determine how do you want to integrate that, if you want to integrate that into your practice. And some of that, to your point, is figuring out, where were we and where are we now and where are we going, and trying to anticipate. And you're trying to learn the fundamentals at the same time as you're trying to like figure out what the future looks like, all at the same time. Um, I similarly, I also use review papers to try and have quick summaries of what you're learning. I think for fundamental knowledge, that's perfect, because then you can kind of go back and say, this is like a review paper on the management of metastatic non-small cell lung cancer, and then here are the pivotal trials. And when you have time, which you never have time, but when you do have time, you go back and try and read those clinical trials, and try and tease out what was important about them, and what was relevant for your own practice. And then I think, as we mentioned earlier, to staying on top of new information that's coming out, I do rely pretty heavily on things like podcasts that you can integrate into your day pretty seamlessly, while you're commuting, or while you're, catching up on notes or things like that. For instance, i3 Health just had one on neoadjuvant management of lung cancer, which I think is a field that's rapidly evolving, and it's difficult to stay on top of that. So having something that's a little bit more contemporary and current on those types of things is super, super helpful. And I guess that would, makes me think of another thing that's really relevant in oncology fellowship, and that is, there's our day-to-day clinical management, and there's sort of as I mentioned, the big picture. These are the trials, these are the sort of the different disease states you have to think about, the controversies within those disease states, and how different people manage different things. So what are your go-to sources, or how do you stay on top of more of the clinical management things, those questions that come up while you're in clinic or on consults, where you just need a quick answer fast? And how is that different from maybe more your long-term learning, the things that you're trying to use to build your foundational knowledge?
So I guess it really depends on the situation. So if it's like looking at next line chemotherapy or like possibly a complication of some sort of treatment we've been giving the patients, I would start from like a different resource for each one. With NCCN guidelines, I didn't realize this when I first started fellowship, but I think you kind of figure it out through. There's a really nice summary section at the end. And so if you're really looking for like one or two short points, those are where I would go to, at least for like some of the things that I'm just not used to as managing as well. For example, like gynecological malignancies, because at some institutions the chemotherapy is given by the surgeons versus like the medical oncologists. So that's where I would start. But the other thing that I also found very helpful is there on NCCN there's another section for supportive oncology too. And that's really helpful for a lot of the side effects, like in terms of immunotherapy. And that's been like a really go-to for at least like looking up dosing on something very, very quick. But it's I usually use like I would say the NCCN guidelines, at least the structure for like very fundamentals to make sure I'm not missing something for like staging and workup. But in terms of choosing the right treatment, it's really like the NCCN guidelines. It's really tough to navigate which one's next.
It's very challenging, I would agree. I think in my practice too, I feel the same way that take lung cancer for instance, stage 4 lung cancer. You look up the NCCN guidelines and you see, non-driver mutated, you use carbopem-pem, but you could also use ipi-nivo chemo, like checkmate 9LA regimen. And, the NCCN guidelines doesn't, break it down which one's better than the other. And when you look at the papers for the trials, they're very similar, that they the toxicity profiles, the efficacy benefit, there's nuances between the two. At my institution, we use mostly carbopem-pem, but you have to augment those types of sources with things like podcasts or articles with some of the leaders in the field to try and understand, as well as your mentors at your local institution, to try and understand why we do this versus that. And it's not, the NCCN guidelines makes everything seem as though it's like very cut and dry. And you mentioned immunotherapy toxicities, which is a particular interest of mine, and I think we've all looked at the ESMO guidelines, the SITC guidelines, these NCCN. They're all very similar, but when you manage patients, it doesn't look like that. People don't respond within 2 days to steroids. You often have to do management of steroid refractory cases with pneumonitis and colitis, and it gets very, very nuanced very fast. And having those other sources where you're actually hearing from people that are doing these things and are experts in the field is pretty critical in my opinion.
I think another thing to at least like gain more collective like clinical experience, because no matter what, you just won't have enough patients to know every single thing there is about hemonc, right? So one thing I've also really loved is going to tumor boards for cancers and just listening to what other people say, because you'll hear from like different people that have a lot of experience in this one type of cancer, and it'll at least help you troubleshoot how to manage another patient moving forward. And I think there's one thing about textbook knowledge, but also translating it to clinical practice is really tough. So for me, like tumor boards also had really helped with transitioning.
No, absolutely. I think that the wealth of knowledge you hear in tumor board, even cases that you think are relatively straightforward in your mind, you present them at tumor board and you realize there was several things you didn't consider or think about. And that's just the wealth of knowledge and experience that people have been managing this a lot longer than we have. And it's really, really good to learn from them. What have you found some of your mentors to do at your institution with regards to learning or staying on top of new data that comes out or controversial data that comes out?
So I feel like that's really tricky because everybody has their own system of how to manage some of these things, right? So um, like my mentors have them all over. Like it depends on the type of cancer we're working with too, and like the mentors. So some really like will send out every review or like every like review article to like at least guide you through the pivotal trials, and then we'll send out the newest articles that come out. But then we also have like formal and informal journal clubs where we would discuss it too, because sometimes when you just don't have enough clinical experience, you don't really know how important or like how to like fit this new article is into like clinical practice, because it may just not have enough patients and you really shouldn't use it in your practice, but it has a lot of potential and you might just need a few more articles to come out before you would start using like those findings.
No, absolutely. No, yeah, it is a tough field in that regard to sort of stay on top of. I guess I would finish with, what would be one piece of advice you would give someone who's either a hospitalist about to become a hemonc fellow, or a third year resident or chief resident who's about to become a hemonc fellow? What's one thing that you wish you knew that you didn't know, and what's one piece of advice you would give them?
So I think one of the I guess like misperceptions a lot of people have when they first come into fellowship is that they have to know everything, and just realizing that it's, the field is so changing every single day. Trying to stay on top of every article is going to feel like you're drowning.
Mhm.
So I think making sure you're focused on having like a really good fundamental of knowledge at the beginning is probably where I would first focus on, and then once you have that, trying to focus on your area of interest is it's much easier to like be on top of all of the articles that come out for one type of cancer like leukemia or melanoma, because you at least have the fundamentals to build up and you know how the trials like change with one another. It's very tough to know every single thing about every single cancer. And I think so that's one thing I would say. The other thing too is to not like forget some of the softer skills about being an oncologist too. There's really no textbook that tells you how to transition from being a resident or like an internist to like an oncologist, and that's a very unique role. And so, like not forgetting those skills about transitioning to a consultant, making sure you're taking care of like the cancer portion, but then also looking at a patient holistically is probably um, one thing I tell people not to forget.
No, absolutely. I think that resonates so much with me. What you said about, it's easy to say. It's easy when you're in clinic and you're working with a thoracic oncologist. They rattle off data, but they've been living thoracic oncology only for 10 years. And I feel like as a first year fellow, and I still feel like this now, that sometimes it's almost like you're joining a movie halfway through. You didn't see like the first half of the movie, and you're kind of like trying to come up with like the plot points, but you don't really know. And it's challenging. And I think for people transitioning to fellowship, it's important to know that even people who have been oncologists for 25 years go to tumor board and are humbled by the things that happen with patients and the things that they don't know, and just how much we don't have control over some things in oncology. And I think the one thing too that I would say about oncology that's in addition to just the vast amounts of information that you have to stay on top of has been it's a challenging field. The patients are sick, and I wasn't as prepared for that when I started fellowship. I think I thought that it'd be very similar to residency, but it's very humbling on a daily basis to meet people who are terminally ill. You run out of options quickly with them, and it can be very challenging. So I think taking out time for yourself and connecting with your colleagues is really important. And I know palliative medicine is something very important to you, and that's something that I think is really a big part of fellowship that I underestimated when I started.
Yeah, I feel like that was something that a lot of like fellows and attendings just aren't prepared for until you just get your hands in and are like really practicing, because it's like the patients are so sick and they have a reason to like really be so overwhelmed, and there's a lot of like need for an oncologist to really manage so much of like the primary aspects too. And it's something that you just don't realize because other consultants can focus on one organ, but cancer and chemo affects every organ in the body. So you really have to be a good internist.
Right, absolutely. I would agree with that. And again, to pull things back to immunotherapy toxicities, I feel like we all have to be really great internists, because you can't just be siloed into thinking about your one type of cancer. I mean, it's just it's too complicating. That the therapies are too complicating, the patients are too complicating. But I think the taking care of really sick patients every day and just the vast amount of knowledge that we have to stay on top of does make HEMONC fellowship a very unique, even from other. I'm not sure other subspecialties would agree, but I think it's a very unique and rewarding but very challenging field to be in.
Oh, absolutely. What do you think like your mentors or like attendings have done to help you with like some of those challenges?
Yeah, I think my mentors that I've had some really wonderful mentors throughout fellowship, and I think the biggest thing that I've learned from my mentors is to always be humble. I think I've had some mentors that are just phenomenal at teaching on the go, and can really help you build that foundational knowledge quickly. But what I've always seen them demonstrate to everyone they work with, it doesn't matter who, patients, other physicians, everyone, the support staff, nursing staff that works with them, is that they're very humble and down to earth. And because they realize that, in oncology, such little is in our control. And it's a very challenging field, and that, you really can't be too sure of yourself with anything, because we all are caught off guard, by how patients do, the outcomes, it's a challenging field to be in. And I think, that's been one big thing. And, the best mentors I've ever had are reading constantly. It's amazing how much, if something's published or presented at ASCO, they know about it before anyone else does, it seems like. And I think in some ways you do have to sort of push yourself to keep reading and be like a lifelong learner. And I think that's where things like podcasts really come into to help me personally, because I find it hard to sit down and read just journal articles. I would love it if I got up in the morning and over coffee I was, cranking through 2 or 3 journal articles, but that's not so much my speed. But if I can listen to a podcast, especially with some of the more prominent people in the field, or people who manage these diseases, and hear their opinions about new data, to me it's almost entertaining in a way, but you're learning at the same time.
Right, it's much easier to fit in a podcast like while you're like multitasking versus like really trying to digest or like a very 20 pages of something off of a journal.
Yeah, if it's like 6:30 in the morning and you're like, well, this hazard ratio is different than that hazard ratio, you're like, I'm
Yeah.
I'm I'm not getting there that way. But for some people that works. But I think, you know, uh podcasts, articles that sort of distill down information, and to your point, that serve as good starting points. You listen to a podcast and you're like, someone mentions, like for instance, carbopem versus checkmate 9LA, and then it compel you to go up and look up the trials and make your own decisions about how you want to manage those things. So it can be just a good way to stay on top of the information, and be a good starting point for other things that you want to look into.
I think the other thing you said too about just being a lifelong learner, that's so important in oncology. And I feel like you don't really understand it until you actually start practicing. And most of my favorite attendings, the best like mentors I've had, it's not that they're just interested in learning like the newest articles or the data. They're actually very curious about like developments in all areas of medicine. Like if they don't know, like I had an attending come up and like ask me how to interrogate a PCA so that they could like catch problems with our like patients that have sickle cell disease too. So it's like knowing skills outside of just oncology, but also like in internal medicine in general and like other areas would really help us like create more research too, to be like better researchers, but then also like manage patients better.
Oh, absolutely. I couldn't agree more. I think the best mentor I've ever had, him and I were sitting at a like the best of ASCO type meeting, and during the meeting, he was taking all these diligent notes in lymphoma, and he's a thoracic oncologist, and I was like, what are you doing? Like this doesn't have anything to do with you. And he was like, of course it does. It's oncology. I mean, because you don't know, you may hear about some new molecular target, or you may hear about a trial that had an interesting aspect, or some type of toxicity from a therapy, or just hearing something outside your own area. To your point, makes you much more well-rounded, and those are the people that are really, exceptional, as opposed to just doing their job well. And it really does get back to being a lifelong learner.
And especially like so many of our patients, they live longer. They might actually have 2 or 3 cancers at the same time. So you really have to learn how to manage both. You can't just pick one.
Yeah,
Or
absolutely.
or your like biopsy could be misdiagnosed, and you really have to know what was missed so that you can actually direct them to the right team or methods too.
And everyone can teach you. I mean, I've learned just as much from the nurse practitioners I work with, or the oncology nurses, as I have from attendings. I mean, everyone has this, wealth of knowledge, and the more you know, the easier your job is, and the less you rely on other people, and the more enjoyable your job is. So I would totally agree with that. Well, perfect. I think this was an awesome conversation. Thank you so much for taking the time. I think, learning and fellowship seems like a very straightforward topic, but for me, it certainly hasn't been. And I think I still refine how I learn, and how I absorb information. And it's great to catch up with you, and talk about these things.
Oh, thank you so much for having me. It was definitely a lot too, like for me to get into learning. So it's nice to hear that like other fellows also have had similar struggles and like how they've adapted to grow.
Absolutely.